So it is brief about Dr. Ghosh. He's associate professor at the Delhi School of Economics. He's received his PhD in economics from the Boston University, USA, and has taught at Texas A&M University, University of British Columbia, and the Indian Statistical Institute. Dr. Ghosh research focuses on game theory and information economics. He has written about contemporary policy issues in various Indian newspapers, including Hindustan Times, Economic Times, and Anand Bazar. His recent article regarding the Marshall Plan that he's suggesting has been published and is read widely. So we had requested him to deliberate on that particular topic, to which he has kindly agreed. I thank Dr. Ghosh and welcome you for this webinar. And I kindly request you to start with your deliberation.
Okay. Thank you very much for this invitation and the opportunity to share my views on topic which really sort of gripped the world. We are in unusual times, and all of us are trying to catch our breath. Needless to say that, of all the immediate and major problems that's facing the whole world and all nations right now, nobody has either a crystal ball or a magic pill. So we are all struggling to find our way through this hazardous path. And there's an enormous amount of research, discussion that is going on all over the world, across disciplines, between academics and practitioners. And this sort of collaborative effort, of course, has to be kept up. So I will tentatively offer some of my thoughts, again, with the necessary qualification that all of us are really trying to regain our balance, as it were. And so take everything I say with a pinch of salt. Let me just mention that what I'm going to talk about is based on two articles I've recently written. The first one was just referred to. This came out in Ideas for India on the 8th of April, called We Need the Marshall Plan to Fight COVID-19. I will send over these slides, and some of the references that I will be using are there in hyperlinks. So anybody who has a copy of the slide can click on the hyperlinks and go to the relevant material. So this was the first article which I wrote. And then subsequently, I wrote another article which I brought out in medium.com called It's Not the Economy Stupid, which is a riff on this famous line which Bill Clinton made into a political slogan in the 1992 election, because America had fallen into a recession at the time. And the incumbent president, George H.W. Bush, was thought to be somewhat disconnected from the lives of ordinary people. So Bill Clinton coined the term, it's the economy stupid. That's the main issue. That was the message. So you'll see in a while why I named the second article, the economy stupid. So let me start with the second article. And what I want to do in this talk is to sort of create a bit of a conceptual framework, or at least the way I'm sort of thinking about it in my head. So I'll try to create this conceptual outlines and highlight some general conceptual points rather than getting into a lot of data or nitty-gritties. I mean, those things are still evolving. We are still, there's a lot of question mark on a lot of, how to understand the huge volume of data which is fast evolving. For example, what's the mortality rate? There are huge debates which are going on. So I'll keep it sort of relatively light on detail, but let me talk about some of the conceptual points. Now, one framing which has emerged over the last several weeks in discussions is that we are facing sort of a twin crisis. It's not one crisis, it's two crises. One is, of course, the crisis of the disease outbreak. So much of the sort of message comes from epidemiologists who have studied these things and have sort of models which they calibrate and based on which they make their predictions. And then on the other side is an economic crisis. So this picture is a picture of the famous fable from Greek mythology, of the fable of Scylla and Charybdis. So when Odysseus was sailing, he had to pass a point where on one side was this monster called Scylla, and on the other side was this whirlpool called Charybdis. So one portrayal people are giving is that, on one side we run the risk of being demolished by the disease, and on the other side there's this whirlpool of, let's say, economic recession and collapse, and there's only perhaps a very narrow path in between that we have to carefully chart. Now, the epidemiological crisis, I mean, I don't need to sort of repeat the obvious. I mean, people have been, all of us have been reading volumes about this. But basically, in the initial phases, the disease grows exponentially. So it quickly overwhelms healthcare systems. Healthcare systems, especially ICU bed capacity, is often close to full. And it's sort of designed, the number of ICU beds is designed with normal times in mind. Now, when the surge of the epidemic hits, even though maybe 5% of affected people will require ICU care, because we don't have herd immunity, it quickly swells to a lot of critical care patients. And that can overwhelm healthcare systems. In the Imperial College study by Ferguson and others, their projection is that if the disease was allowed to run unchecked in Great Britain, for example, then at the height of the pandemic, at the sort of peak of the curve, the number of people needing ICU care would outstrip the number of ICU beds by 30 to 1. And remember, even those available beds are 80–90% full in normal times. So only about 10 to 20% are free. So there's a huge gulf. And this is basically what people have been worried about. Now, but in the process, as we have gone into lockdowns, it's a very unusual kind of situation where workers are shut at home and other than essential production, everything else has come to a standstill. So I'll talk more about the economic shock in a moment. Let me note a couple of points from the epidemiological side, which will have a bearing on my discussion on the economics. I'm an economist, so I'll focus on that primarily. This is a picture which comes from that Imperial College paper, which I mentioned, which has apparently been very, very influential in shaping policy both in the UK and in the US. Sort of this belt tightening which happened was influenced by this paper. Now, let me just explain the color legend. So if no measures were taken, then this black curve is the number of infected people at various points of time. That's their estimate. The other curves are what would happen if various kinds of measures like social distancing, lockdowns, etc. are put in place. This shaded area is a length of time which is a hypothetical lockdown. So, so if you look at the bottom panel, the dark line is what would happen if no policies were taken to suppress the disease, and the green line is what would happen under strong measures. So this is the concept of flattening the curve. The red horizontal line is basically ICU capacity. So if strong measures are taken, the disease, falls below. We manage to keep it below ICU capacity so that it doesn't overwhelm healthcare systems. But in the same projection, what you see is that the green line is really a postponement of the surge, right? So once lockdowns are lifted, eventually the surge will come. So what the lockdown does is it really buys time. Time to, for example, ramp up healthcare facilities, ramp up testing facilities, take proper economic safeguards, and so on and so forth. So this is something which is very important to keep in mind. Now, beyond lockdowns, what can be a reasonable long-term strategy? Because as I just said, the problem is not going to go away. We are merely buying time with these strong measures. Now, as far as the long-term strategy is concerned, there are two aspects, of course, the epidemiological aspect and the economics aspect. So I think a lot of people would agree that as far as tackling the disease is concerned, eventually we have to go for more targeted, more surgical strikes. And this has been the experience with some success of Singapore, Taiwan, South Korea, and some of these Asian countries. Although there are very recent reports that cases are creeping back up in Singapore, maybe in Korea and so on. But anyway, they have had remarkable success. And the sort of various things that they have done, one is test, as the World Health Organization called it. Then there's sort of trying to identify people who have been in contact with those who have caught the infection, trying to isolate them, and tremendously ramp up healthcare capacity, protective gear for doctors and nurses, hospital beds, and so on and so forth. So eventually, beyond sort of the hammer blows of shutting everything down, there has to be a strategy in place which is much more targeted, much more precise, much more surgical. Now, what about the economics? If you agree with what I just said about the epidemiological aspect of it, then the economics also have to plan and brace for this long haul, because it's not like we can go back to usual economic activity overnight after the lockdown is lifted. So problems may continue long after the lockdown. And let me sort of give you in capsule what I think are the two main things to be done, to sort of broad planks of policy making on the economic side. One is there's a massive job of protecting the economically vulnerable. So given the nature of the economic shock, a huge number of people in India, as well as in the prosperous countries, a huge number of people will become very vulnerable economically. So there's a need to protect them. A second aspect, which is the last bullet point here, I find there's not enough discussion about this, so I talk about it in the end, but I think it's a very important aspect, which is to create incentives for testing and isolation. So again, as I said, the long-term strategy has to be some sort of, widespread testing, isolating the infected, that sort of policy. Now, economic incentives will be very important if you want the cooperation of the people, if the government wants the cooperation of the people for a strategy like that. So what kind of economic incentives can be provided is something I'll talk about at the very end. Now, let me come to the nature of the economic shock that has been felt all over the world. There's a lot of talk about GDP. The GDP is going to fall. Goldman Sachs, every other day, they're revising their GDP estimates. Currently, I think they're saying that in this quarter, US GDP is going to go down by 30%. And various terms like, this is the greatest decline after the Great Depression. Such words are being used widely. So this slide shows you the projections by the IMF. They're projecting a negative 3% growth, and this other panel shows you, their estimate of how much GDP will be lost, and they're coming up with figures like $9 trillion and so on. So a lot of the discussion is focusing on GDP loss. You can call it, the shrinkage of the pie. I'm going to say in a moment, I'm going to take a slightly contrarian view on that issue. But before that, let me tell you some of the ideas which people have thrown up about how to make how to arrest the fall in GDP to the extent possible, while not compromising in a big way the fight against the pandemic. Some people, for example, here's this New York Times article by Katz. They argue that the mortality rate is being highly overestimated because of the denominator problem, that a lot of people who are asymptomatic or who have mild symptoms, they're not coming for testing. So the death rate only is being calculated among the very sick. And so his solution is that isolate the elderly, take some precautionary measures, but otherwise go for herd immunity. And that is one strand of opinion. Then there are other opinions, and then there are these two, the second bullet point, Devotchuk and others, and Romer and Barber, they have said, okay, let's also be more targeted in what economic activity we allow and what we shut down. So there are these serological tests, which test for the presence of the antibody in the virus. So if the antibody is found, then that means that that individual has already caught the disease and has developed immunity. Although everything right now is nothing is 100%. So there are some sort of doubts on this aspect. But it seems very likely that the presence of antibodies in a person's bloodstream means strong immunity, perhaps, to the disease, at least for maybe several months or a year. So these guys, they are saying that, well, instead of locking everybody out, allow people whose bodies have been found to have antibodies, let them back into the workforce, keep the others out. Ray and Subramanian, they say that, well, look, the mortality rate in the younger population is much lower, so they face less risk. So allow the under 40 people you can sort of do ID checks and so on, but allow the under 40 to get back into their jobs and into production. Then there are other proposals that, there has to be sort of punctuated lockdowns, have a lockdown for a while, then as the disease goes creeping back up again, then bring in another lockdown. So it's like stop and go kind of strategy. Now, all of these are focusing in a big way. I mean, the implicit assumption seems to be that while we have these, drastic reduction in economic activity, the collective pie for us is going to get very small, going to get smaller, and that's a big source of the problem. But I would say there's another aspect to the economic problem, which is how the pie is divided, right? So the pie will shrink, and it will be divided in a radically different way. And I'm going to argue that, the inequality, I mean, already we had grumblings and a worldwide discussion about inequality before we ran into this virus. And that inequality is going to look like, small potatoes compared to some of the inequality which is likely to crop up in response to this disease. By the way, all of these are intuitive statements. I mean, in normal times, what economists do is that they have demand estimates, so if you have an ordinary recession, not this sort of unusual thing, then, we can do sort of estimates depending on demand elasticities. We can estimate how the auto industry, what will be, the fall in demand for the food industry and so on. But all of that goes out of the window because this is a massive, massive shock of a kind that we haven't seen before. Nevertheless, how inequality or income distribution will change, we can get at least some broad cues about that by looking at certain past experiences. So I'll talk a little bit about that. But let me go back to the issue of GDP contraction. If these economic disruptions happen for 2 months, 3 months, a few months, I think the impact on GDP is being very much overestimated. Okay. First of all, productive capacity is preserved. So this is a difference from things like wars and even the Great Depression, which ran on for years, and agricultural fields went to waste, and so on and so forth. The factories rusted away. Nothing like that is going to happen if we are in kind of lockdown or social distancing situations for a few months. Secondly, there's production and consumption. A lot of it can be shifted over time. So let's say the auto industry is not making its cars right now, but they can bring in workers, after this is over, they can bring in workers, cut short the weekend, go into overtime. So as far as car production is concerned, as well as purchase is concerned, it's flexible timing wise. So everything that we don't do right now a lot of it can be made up later. Now, not everything can be made up. Haircuts can't be made up. If I skip 4 haircuts, eventually I'll have 1 haircut, not 4 of them. back to back. And here's one thing to sort of ponder, that, you know, in normal times, at least in the prosperous countries, there's 2 8-day weekends. In some places of Europe, 3-day weekends. So essentially a third of potential GDP is being lost, and nobody calls that an economic catastrophe. We call that weekends and holidays, right? So there is this flexibility also, which will mitigate the fall in GDP. Then the team production, you know, if you open a restaurant, but the chef in quarantine or sick and the waiter is ready to go, that's no good. All right, so that's a complication which these plans from the previous slide don't take into account. And of course, essentials have to be produced. And I do realize when I'm sort of underplaying the GDP impact, that after the pandemic is over, whenever that is, let's hope sooner rather than later, there will be an economic problem of transition, right? It's not like, you know, I don't want to sound so naive as to say that, you know, next morning we can go back to full steam. That might be a problem in restarting the economic engine and so on. Let me show you a graph from a study by Barrow and others, which is the impact of the 1918 flu epidemic and World War I. They happened around the same time, but there were cross-country variations, both in the incidence of the flu and the war deaths, the impact of the war. And they exploit that to estimate what was the effect. And as you can see from the picture, in the immediate aftermath, you know, just after these things were over, in the next year, 1919, I think, the two events had an impact on GDP of roughly similar size, right? So the flu was comparable to the war. But what Barrow and others show in their paper is that the effect of the fall in GDP due to the war was much more persistent. It went on for several more years. Whereas the effect of the flu, there was a quicker bounce back, and subsequent increases in production at least partially made up for it. So that's one piece of good news. Now, let me come to the other aspect. As I said, there are two aspects to the economic problem that we face, and both are major. I don't want to say either of them is trivial, but I'll try to persuade you that the income distribution problem arising from this shock now is orders of magnitude more serious, at least in the short run, compared to the shrinking pie problem. Again, let me show you a little bit of historical tidbits, and really this has been on my mind ever since I read Amartya Sen's work on the book Poverty and Famines in college. And one of the things that Sen argues in his book, and this is the chapter on the Bengal famine, there was some, of course, shortfall of food availability, not so much due to shortfall of production. There was no major drought or anything, but the British war policy diverted some food grains for soldiers. So there was some shortage for civilians. But largely, one of the reasons why so many people died, about 3 million, is that certain kinds of livelihoods were absolutely wiped out, right? So people became poorer, but they didn't become uniformly poorer. So let me show you two tables from Amartya Sen's chapter on the Bengal famine. This table on this slide shows you the, starting from 1939-40 and leading up to the famine. It shows you index 1940 prices. When we are in the middle of the famine, it's almost fourfold. Food prices rise has increased 4 times. But look at the wage index. Wages have risen only 30%. So landless agricultural workers who work on other people's land, their purchasing power is really a third. At the height of the famine, it's a third of what it normally is. Now, these are poor people to begin with, and then their purchasing power is cut by 2/3, and that was catastrophic, right? So that led to a lot of death of these guys. Here's another interesting table from that same essay. And here it shows, again, price indices with 1941, all the prices are normalized to 100. And then as you go down each column, you see the price index of the relevant commodity. I'm sorry, I cut off the top of it, which gave, what commodity is. I didn't notice that. But the last column is, I remember, is haircuts, right? So what was the price of haircuts relative to what it was in 1941. So remember, food prices went up fourfold, and sorry, these numbers are price of a commodity. For example, last column is haircuts relative to the price of rice. So if you come down to, so again, the initial year is normalized to 100. So if you come down to May of 1943, that's the peak of the famine, barbers basically in real terms were earning barely a fifth of what they usually earn. So when you look at the mortality statistics of the famine, it was highly concentrated in certain groups like barbers and fishermen and landless laborers and so on and so forth. So that teaches us something that this kind of massive shifts in the income distribution makes the pain concentrated on certain groups, and that is often the big source of the problem. If somehow the pain was more evenly shared, then we collectively would have much greater economic herd immunity, if you will, right? We would all be able to bear it. Now, my sense is, and again, not based on running numbers because we don't have data, things are evolving very quickly, but intuitively, if you think about it, certain industries are going to be hit very hard, travel industries, travel related, and so on. Whereas online, certain companies and certain businesses can actually do well in this current situation. Online retail will get a boost because brick and mortar retail has suffered. So here on this table, I'll show you, the movements in the stock prices of some major blue chip companies over the last 3 months. We don't yet have quarterly reports on revenues and profits, so we can't use that sort of data. But this stock price movement can be thought of as a rough proxy. If you look at these graphs, and I didn't go cherry picking really. I mean, if you, for example, instead of Delta Airlines, you could use any other major airline. So what you see is that, this bar is the Dow Jones index. So about 4 or 5 days back when I came up with this, the Dow Jones had fallen about 17%. Now, Amazon, Walmart, Microsoft, Apple, they have all done better than the market. Some of them have, Amazon stocks, in fact, have gone up more than 20%. Whereas if you look at some of the sort of big players like hotel chains, Marriott, airlines, Delta Airlines, even banks, because, there's sort of financial turmoil at the background. So Citigroup, their stock prices have fallen 40%, 50%, so major falls. So how can we tackle this sort of economic disruption? Well, since there's likely to be a tremendous increase in inequality, one solution, of course, is to spread out the pain, as it were. Use taxes and subsidies to even it out, so that the impact on any one household or one set of companies is not very big. So what we need to do is we need to sort of compensate the big losers by taxing the small losers, right? So this is different from taxing, redistribution from the poor to the rich. The need of the hour, of course, there are sort of long-term issues about inequality and, whether, social justice, whether we need to sort of do much more redistribution. But putting those issues on hold, at this point in time, some people are taking in very big losses and some people are not taking in not so much losses. The barber in the market which I visit, shop is firmly shut. He's not earning anything at all. Whereas I'm on a fixed salary. So I haven't had a single penny cut from my paycheck. So that is an enormous disparity in fortunes. So in principle, we can do that sort of redistribution, but with the usual tax system, there are two problems. One is the tax base. Usually the taxes are calculated on your absolute income, not how much income loss or gain you have experienced this year. So we need a special pandemic tax which targets change in income rather than income per se. That's my argument. So in other words, if you go back to the previous slide, if you're talking about bailing out the airlines, helping the banking industry, helping out the auto industry, to put all of that on the government would really squeeze the government out of fiscal room. But one thing you can do is that there are opportunities up here on the left side of the scale. Companies which have not made huge losses, some of them have made merry actually. Why shouldn't they pay a sort of special tax for the year, which can go towards creating economic assistance for the ones who have taken big hits? And the same principle can be applied to households. So that is fine in principle, except that tax assessments are annual, right? There's a timing issue that even if the government has a plan to impose a special pandemic tax and subsidies for those who have taken big losses, it'll take time for all that money to be exchanged. So people who are for the next 2 months not going to earn anything, they're going to starve. So that's not going to solve the problem. So the solution to that is what I will call in this context a temporary universal basic income, but that's not quite an appropriate term for what I'm suggesting. You could think of it as a universal basic advance. So some countries, especially the prosperous countries, are doing this already. They are sending some checks. The US, I think, can send a check of up to $2,500 for a family of 4 with 2 working adults. But it's being sent as aid, right? So one way to tackle the situation would be to send out these checks to all households. But then later, with the passage of time, when the income tax filing time rolls around, households and firms have to be assessed for how much they have lost. So if you have records on their profits or income from previous years, let's say the average of the last 3 years, and they file, what their profits and incomes have been in this year, that difference is something which the rich countries can easily access. And so those who have lost big can get tax credits, and their net tax dues could even be negative, so that could be subsidized. So all that accounting can be done further down the road. For the moment, households can be given an advance, and firms can be given a credit line. So that's, I think, one way to deal with it. Now in India, things cannot work out this way because we have, the richer countries have an extensive tax network. Most citizens come under the tax network. In India, only 7.5% of adults file even for income tax. But in India, I think the problem is much more aligned with initial, income levels. So it's the poor in India who are likely to have lost big time because they are reliant on self-employment in a lot of cases, as well as working in the MSME sector or working as daily laborers. So their income loss has been significant. Whereas the rich have often been shielded because they're formal sector jobs on fixed salaries. So in India, that cash transfer I was talking about cannot really be treated as an advance, as a sort of loan to households and firms. But it's I think, in the larger scheme of things, it's probably not the greatest injustice to give cash transfers to poor households as aid. And how is this to be funded? Well, one thing which I can, if you will excuse me, I'll just sum it up. Is it too dark?
It is okay, sir. Hello.
sorry about that. The setting sun just came filtering through. Okay, so in the case of India, um, you know, I think the need of the hour is economic assistance to the poor, who many of whom have their livelihoods sort of demolished for the next few months. Now, how is it to be funded? Well, one thing again, which is not being talked about, I mean, there can be a temporary tax on people who are the salaried class, you know, who are in the tax network, or companies who are there. So they're partly, not all of it has to be funded by the government through, you know, through borrowing. Some tax on the fortunate, on people like me, for example, is probably called for this year, as well as on the corporates who haven't had a massive loss of profits. But there's also other fiscal room, so public debt is one possibility. My sense is that in the coming months, there's going to be a huge savings glut, because if you remember the study of the flu pandemic from 1918, Barrow study, if you have noticed, their GDP or incomes fell, but consumption fell even more. So in these tough times, people who have income, they often increase their savings. So savings is, if anything in the economy, is going to go up. But investment, I think it's a safe bet to say in the next few months, investment demand is going to collapse, because, you know, first of all, there's no opportunity, and then because of the uncertainty, who wants to invest? So there's a lot of room for, you know, floating public debt at the time. So some combinations of that and taxes, special taxes, could do the funding. Now, let me show you a couple of graphs where which would indicate that we are very much behind on a lot of these, you know, to do things. One is the testing rate. The testing rate in India has been very low. Now, this figure here, this is number of tests per million. This figure has increased substantially over the last several days, both for US and India. But I think, if I remember, it's still, you know, sort of below 200, if I'm not mistaken, for India. Many other countries have tested much more intensively, so they have adopted strategies to identify the infected much more effectively. So we need to step up on this. But the other thing is that the economic assistance which various countries have been handing out to its citizens, you know, trying to shield the vulnerable from this income distribution shock, we have been very much behind on that too. You know, the 1.7 lakh crore economic assistance package that the government announced, although part of it is pre-budgeted expenditure, it was just, you know, brought forward. So if you net that out, and even without netting that out, it's less than 1% of GDP. And if you look at some of the major economies in the world, they are spending, you know, they have created packages of 10, 15, 20% of GDP. So given the sort of the potential impact of the problem on the vulnerable, that kind of magnitude doesn't seem unreasonable. So in the Ideas for India article, which was much more geared towards India, what I said is that, okay, you know, there's has to be some minimum livelihood support for people because of this disruption. How to identify the poor and what kind of tool to use to get money or cash to them is a problem. Now, there's also a debate going on about in-kind versus cash, right? And the government, one of the sort of major highlights of the economic rescue package was the doubling of the food grains from 5 kgs per capita to 10 kgs. 10 kgs, it so happens, is about, you know, from NSS data, we know that it is the per capita monthly grain consumption for Indian households. So if the 10 kgs is really delivered effectively without glitches to all households, that will be a major relief, I think. But to what extent supply lines and the PDS network has been disrupted is something which is an open question. But anyway, people, but given the sort of major disruption, just delivering the food is not enough. I mean, people need cooking oil. They need, the other big item which has been in the news and which has been at the root of a lot of the displacement of migrant workers is they've been kicked out by the landlords because they can't pay the rents. Now, there's no way you can give rental assistance in kind, right? That requires cash, and that's a major part of the need, which is creating a lot of misery. So I think in normal times in India, there's a cash versus kind debate on which there's sort of pretty strong opinions on both sides. And let me not take a side on that issue. But at this moment, I think there is a great need to give cash assistance to households so that they can pay their rent, they can buy their vegetables, they can buy other household implements, cooking oil, and so on and so forth. What in the Ideas for India article, I made a calculation, and other people have made calculations and they have arrived at similar figures, that suppose, before that, let me go back to the previous table. So there are many different welfare schemes, and this is one of the problems in India, that we don't have a very comprehensive welfare system. So there are lots of different programs which look like this kind of Venn diagram. They have some overlaps with each other, but also to some extent disjoint. So you have PDS, Manrega, the Employment Guarantee Program, Jan Dhan. So which program and its beneficiary list is the best choice if the government has to create a good deal of cash transfers? And my sense is that PDS is the best choice. It's the public distribution system. So this is the scheme which gives roughly 2/3 of the Indian population 5 kgs of grains per month per household member, practically for free, for a very, very nominal price. And that is the amount which has been doubled of late. One of the problems is that you want to create a system where households receive cash assistance and nobody is left out, but neither is there duplication, right? If some households receive a second or a third helping, that's not good, because that's wasting resources, and it's sort of undeserved benefits. So for example, with the NREGA accounts, which is what the government has been using to transfer 500 rupees to women household members. Now, some households may have 3 women in the household, right? So each of them get 500 rupees. Another household may have 1 woman or nobody. Some households may have other bank accounts, not these kind of Jan Dhan bank accounts. So with a lot of these other schemes, the coverage is less than the PDS in a lot of cases, and also the duplication issue is a very thorny problem, right? You can't be sure that the beneficiaries do not have double counts and triple counts. So that's why I think PDS is a pretty clean choice. It has fairly wide coverage. This is not to say there are no exclusion errors. Jean Dresse has written about, many of the recent ration card applications haven't been approved, they're pending. So there will be some people who still won't be reached through the PDS network, but it's still a lot of people, right? If you want to reach 75-80% of the population, PDS gives you access to 67% or so. And there is no possibility of duplication, because every household has a unique ration card. One thing which I'm not sure, I've been asking people who know these granular detail better than me, and there seems to be some confusion, is whether, and I'm pretty sure the answer is no, the question is to what extent are the ration cards linked to bank accounts where the money can be transferred. Now, I did a quick back of the envelope calculation in my Ideas for India article that, and as I said, other people have done similar calculations, arriving at similar figures, that if all those PDS beneficiary lists have to be supported with cash transfers, that will guarantee them above the poverty line for 6 months, then that comes to about 3% of GDP. right? If all of that is done through borrowing, then that will increase the national debt by less than 5%. So the national debt GDP ratio is now about 70%. So it'll go up to 74, 75%.